name is Brianne. I'm going to be your nurse today. I'm going to do hand hygiene and provide us with some privacy. I have orders from your provider today to do a full head-to-toe assessment on you, but first can I get your name and your date of birth?
Sure, Tasha Lowry, 12083.
Okay, great. And then before we get started, do you have any allergies or any medicines that you're on that I need to know about?
No.
Okay, awesome. So I'm just going to go ahead and say that just by observing and inspecting my patient that I can see that she can hear because she's answering my questions. She looks well groomed. She can see because she's looking at me when I ask her questions, and she can also answer my questions just speaking to me. So I'm going to start with your HEAT exam. So is it okay if I touch you?
Yes.
Okay, I'm just going to check your head. I'm checking for symmetrical, no lesions, no bumps or bruises or anything like that. Have you had any headaches recently?
No.
Okay, I'm going to look into your ears and check for any type of drainage. Have you had any like ringing in your ears?
No.
No? Okay, and they're even and symmetrical on your head. I'm going to look at your nose. Your nose is midline to your face, and if you could just tilt your head up for me so I can look up the nostrils. There's no obstructions. Have you had any trouble breathing through your nose or any sinus drainage? Okay, can you just plug one nostril with your finger and take a deep breath in for me? Okay, great. And the other side? Did you have any trouble doing that? Okay, good. So if you could just open your mouth for me now. I can see that your oral mucosa is red and it looks good, and your lips are red and they look good as well. Do you have any loose teeth or anything? No? Okay. And then I'm going to check your eyes now, and they are even and symmetrical with your face. I'm going to check for accommodation. So I'm going to do, if you could just look at me. I'm sorry, this is direct and consensual. So I'm going to just shine the light direct. I'm looking at the other people, and it's constricting and it's consensual. I'm going to do the same thing on the other side. Okay, direct and consensual. And then if you could just look at that back wall for me, and then look at my pen, and then look back at the wall. All right, and your pupils do accommodate as well, and they are round and reactive to light, so I would say that your pupils are perla. All good things. Have you had any blurred vision or anything lately? Okay, great. And so I'm going to go ahead and move on and check your throat as well. So if I can just touch you right here, can you swallow for me? Okay. Do you have any difficulty swallowing? Okay. And your trachea is midline, so that's all good as well. Can you really quickly just tell me who the president is?
Joe Biden.
Okay. And can you tell me why you're here?
Yes, I'm having a checkup
Okay. And can you tell me where you are?
at the hospital.
Okay. And because you seem to be alert and aware, this doesn't necessarily apply to you, but the Glasgow scale is just a scale that we use to measure eye function, motor function, and verbal function on patients who have recently been in a coma or how they're coming out of it, but you seem to be alert and oriented times 4. I'm going to go ahead and move on to your skin assessment. So I'm just going to palpate the skin really quickly and just kind of feel that you have a regular temperature. I'm going to do a skin turgor test, which is just a little pinch right here, and it has rapid recoil, so that seems to be good. I'm going to check your scalp as well to make sure that there's no bumps or bruises or anything like that either. I'm going to look at your fingernails too. I'm going to look at your capillary refills, which you could do this in the cardiac assessment as well. And I'm looking for clubbing of the fingers too. Capillary refills are normal, less than 3 seconds, and I don't see any kind of clubbing of any fingers or anything like that. Your skin tone is even, and it goes well with your ethnicity. I guess that's how you would say that. But yeah, everything looks regular and normal. Have you had any dry skin, or are you itchy or anything like that?
No.
Okay. And then I'm going to just inform you about the Braden scale, which is it could put your skin at a risk for compromise if you were to be overly moisturized, if you didn't have adequate nutrition, or if you didn't have adequate mobility as well. It could put you at risk for skin tears or ulcers or something like that, or anything like that. So now I'm going to move on to your cardiac assessment.
Okay.
So I'm just going to ideally have you up at a 45-degree angle and check for jugular vein distension.
Okay.
So if you could just look that way for me. Okay, great. And the other way. Awesome. And there's no jugular vein distension that I can see. So now I'm just going to go ahead and listen to your cardiac sounds. So I'm going to listen to the aortic, and the pulmonic, the Erb's point, the tricuspid, and midclavicular down to the fifth intercostal space is the apical pulse, which you would auscultate for a full minute. And then S1, S2 sounds are present. And I'm going to go ahead and check for edema. And I'm going to start at your most distal point, and I'm going to work my way up. And I don't see or feel any edema present. Okay. Have you had any chest pains recently?
No.
Okay, great. So now I'm going to move on to your pulmonary assessment. So I'm going to ask you if you've had any trouble breathing or anything like that.
No.
Okay. Have you had any cough or anything like that?
No.
Okay. So if you did have a cough, I would educate you on the turn and deep breathe, where it's like you lay on your side and you take a deep breath and then you try to expel all that excess mucus out of your lungs. And then this is an incentive spirometer. And if you would take that and you would just inhale with it 10 times every hour. We like to tell everybody maybe 10 times during each commercial break of your TV show that you're watching. So now I'm going to listen to your breath sounds, your pulmonary sounds. So I'm going to listen to the right upper lung. Okay, ideally this would be on bare skin and you would be taking a deep breath with every placement of my stethoscope. This is the left upper lung. And this is the right middle lung. And the left upper lung. And then if you could just put your arms out for me. I've got your right lower lung. And your left lower lung. Okay. You can lean forward. Your right upper. Left upper. Making sure that I'm not on the scapula. Right lower. And then left lower. Okay, perfect. And so going back to, I'm going to jump back really quickly to your cardiac assessment as well. I just wanted to point out a couple of pulse points for you. So you have your carotid, you have your brachial, your radial, your popliteal, your posttibial, and your dorsalis pedis. And I'm just going to check your radial and bilaterally. And there's also femoral as well. And then your dorsalis pedis bilaterally, which is about, I would rate it about a 2. And the same as your radial as well. And I would do the same to your posterior tibial. Okay, thank you for letting me go back to that. I totally forgot about it in the beginning. So I think your breathing rate, it looks very unlabored and even and symmetrical. So that all looks really good. So now, ideally, I'm going to move on to your gastrointestinal inspection. You would be laying down for this portion. So I wanted to start there. So visually first, I'm just going to inspect the skin and make sure that there's no distension or any type of stretching or anything like that. Do you have any stomach pains I need to know about? Okay, so I'm just going to start off by listening and auscultating the quadrants of her stomach. And I'm going to start in the right lower, and then go to the right upper, and then to the left upper, and the left lower. And then I would flip my stethoscope over to the bell to listen for grooey sounds, which none are present at this time. Have you had any trouble, let's say, with any bowel movements recently? When was the last time you had a bowel movement? Have you had any problems passing gas? No? And then have you had any issues urinating? Okay. So, and I'm going to palpate each quadrant as well. And as long as you're not sensitive, I can gently palpate each quadrant. Okay. And that all seems good. So now I'm going to move on to your musculoskeletal. And I'm just going to brace your elbow, feeling for crepitus. So if you could just flex for me and extend, and then against my strength. There you go. And then do the same thing, bring it up and push against me. Awesome. And then I'm going brace your wrist and do the same thing so you can extend, hyperextend, and flex, and then do it against me. Awesome. And then I'm gonna check your knee as well. So if you could just extend and then flex. Okay, now do it against me. Great, and then do it again. I'm gonna work my way to your ankle too. So you could do dorsal flexion, which is down, awesome, and then, plantar flexion, yeah, that's right, sorry. And then you could just do it against my hand, and then you can push the gas pedal. Awesome, so I'm gonna come around, do that really quickly again on the other side. So flex, extend, flex, extend, okay. Hyperextend, awesome. Extend and then flex, awesome. And then just doing it against my hand. Okay. I'm gonna do the same thing with your knee. So if you could just flex for me, extend, there you go. And against my hand. Great, and then same with your ankle. Okay. There you go. And then do it against my hand and push the gas pedal. Awesome. Okay, so now I'm just gonna have you stand up. We're gonna check your gait, so if you could just walk for me. Perfect, everything looks good. So you can come back tandem, heel to toe. Great. Okay, so now you can just stand here. I'm gonna put my hands right here and make sure you don't fall. This is called a Romberg test. And everything looks fine. You can go ahead and sit. Have you had any problems walking lately?
No.
No? Okay, great. So do you have any other questions for me?
I don't.
All right, I'll let your provider know and he'll be in shortly.